Safety Toolbox Talk: What to do in case of an injury. What do you do when there is an injury? When an injury occurs on the job, knowing how to respond quickly and correctly can save lives and prevent further harm. This talk covers immediate actions, CPR, wound care, and aligns with Ironsmith Fire's safety protocols. Assess the situation. Ensure safety. Confirm the area is safe for you and the injured person. Avoid hazards like live wires, machinery, or unstable structures. Do not endanger yourself. Never put yourself at risk while attempting to assist. Give direction to bystanders for what you need them to do. Call for help. Contact emergency services. Dial 911 immediately, providing the exact location and details of the injury. Notify Ironsmith Fire. Inform your foreman, charm superintendent, and the Ironsmith Fire EHS manager as soon as possible. Stay clear and calm. Provide accurate information to ensure help arrives quickly. Immediate first aid actions. Check responsiveness. Gently tap the person and shout, "Are you okay?" to assess consciousness. Airway breathing circulation, ABCs. Airway. Tilt the head back and lift the chin to open the airway. Breathing. Look, listen, and feel for breathing for no more than 10 seconds. Circulation. If no breathing, proceed to CPR, see below. Performing CPR. When to start? Begin CPR if the person is unresponsive and not breathing or only gasping. Steps. Compressions. Place hands on the center of the chest. Push hard and fast. 100 to 120 compressions per minute, about 2 inches deep for adults. Allow the chest to fully recoil. Rescue breaths. After 30 compressions, give 2 breaths using a CPR face shield, if available, from the first aid kit, ensuring the chest rises. Continue. Repeat cycles until emergency services arrive or the person responds. Use available tools. Ensure a CPR face shield and gloves from the first aid kit are used, if available, to maintain hygiene. Wound care. Control bleeding. Apply firm pressure with a clean cloth or sterile gauze pad from the first aid kit. Elevate the injured limb if possible, unless a fracture is suspected. If bleeding persists, add more gauze without removing the original layer and continue pressure. Clean and protect. Once bleeding is controlled, clean minor wounds with antiseptic wipes from the kit. Cover with adhesive bandages or sterile gauze secured with adhesive tape. Avoid complications. Do not remove impaled objects, stabilize them, and seek medical help. For severe wounds, keep pressure and wait for emergency services. Other common scenarios. Burns. Cool under running water for at least 10 minutes. Cover with a sterile dressing. Do not apply creams or pop blisters. Fractures. Immobilize with a splint or sling using materials like gauze or tape. Do not attempt to realign bones. Choking. Perform the Heimlich maneuver if trained or seek someone who is. First aid kit essentials. Ensure the kit is accessible and stocked with adhesive bandages, sterile gauze pads, adhesive tape, antiseptic wipes, scissors, tweezers if possible, CPR face shield if needed, gloves. Check kits daily and report shortages to your foreman. Stay calm and reassure. Keep the injured person calm by speaking reassuringly. Help is coming, you're going to be okay. Stay with them until professional help arrives, if safe to do so. Follow Ironsmith Fire protocols. Report immediately. Report all injuries to your supervisor and the EHS department within 24 hours per company policy. Post-incident. Be prepared for a drug, alcohol test after any incident as required. Training. Complete all mandatory driver safety and first aid training to stay prepared. Responding to an injury requires quick thinking and adherence to safety protocols. By staying calm, using the first aid kit, and following these steps, you can make a critical difference. Regular training ensures we're all ready to act. Let's keep safety first at Ironsmith Fire. Thank you